Hello my friends, family and esteemed colleagues. The question came up again about headaches. Well, pain in general. I have discussed in many occasions and there are many articles on it. And this occasion I want to talk about headaches. Why could they happen when we start the self-healers protocol? What causes headache? We have experts talking about many different things, but as any pain, it is being caused by increased pressure on sensory nerves. So is it this pressure caused by trauma, or is it caused by some chronic development, which is always inflammation? And here we have these acute or chronic headaches. Acute happens suddenly, and when it's gone, it's gone. And chronic when they keep reappearing. People that may develop headache during beginning phases of self-healers protocol, they are prone to headaches to begin with. And why so? Because they are dehydrated on a cellular level. As I explained, brain is poorly vascularized. It basically runs on lymphatic system. And the exchanges of nutrients and oxygen and all that stuff happens basically through meninges, which are membranes covering the brain, not preventing the toxic blood to go into the brain, filters it out because only small capillaries are allowing the liquids, the plasma, to flow into the brain. So brain does not even have sensory nerves, so it cannot hurt. So where does headache come from? Comes from the outside of the brain, basically the meninges, but also all the mucosal tissue around it. And if it inflames, the more inflamed it is, the higher pressure it creates, and then from just feeling of being depressed, heavy-headed, starts developing into more steady headache. So now where does the throbbing pain comes into? That we sometimes feel like it squeezes, then let go. Well, this is when the meninges is already inflamed, and now we have increased blood pressure. Now what is causing the inflammation to begin with? Again, it's nothing to do with what we are being told. There is no battle of gen and antigen going on. It is basically forced hydration of the tissue which is dehydrated on a cellular level. So when that happens, basically we have hormones coming to constrict the blood vessels. We are talking here about vasopressin. We are talking about histamine. And as they constrict blood vessels, now the blood cannot leave the meninges so easily. It starts accumulating in there, increasing the pressure. This is what we call the inflammation, and this is what starts causing the pain. And now if you have on top of this some excitement going on, something may happen that now speeds up your heart rate. Every time that you have a pressure increasing, because of contraction of the heart, you have increased pressure now of the inflamed tissue, and it brings the headache, and it goes down, brings the headache. So, why does that happen when people are on a protocol? Well, basically it doesn't, but when it occurs, it's usually withdrawal symptom from caffeine. Now, why is that happening? Caffeine is a poison, toxin. Whenever it comes into the blood vessels, blood cells actually, are thickening their membranes with heat protein, preventing it to seep in. Of course, some of it comes in before this can be accomplished, and it is having excitatory effect on nerves. Now, when we are exposed to this daily, the cellular membrane stays pretty much closed. It's a poor hydration, but at the same time, poor detox. The level of liquid going in and through the cell is becoming more restricted. And when this toxin is present, even though there is a need for more water in a tissue, it's not occurring because the blood is toxic. So when we stop taking this poison, we let go of coffee, we go into what we call the withdrawal symptom. And what happens? The headache starts increasing, and usually is for 3 days, and the third day being the strongest. Now why? Because when we stop poisoning ourselves, blood fairly rapidly detoxifies itself from this toxin. It has a diuretic effect, so you urinate more and you get it out. As there is no more this poison, now the brain cells the cells, dehydrated cells of the meninges, find the opportunity to cleanse. Well, they basically start letting go of some of the heat protein. So the membrane becomes larger, more liquid goes in, and this toxin starts seeping out. At the same time, since the meningus is dehydrated, body wants to help itself a little bit by increasing the speed of this hydration. And since blood is fairly clean, it is going to, because there's not, the nicotine, the caffeine is not there, so it will constrict the blood vessels again by trying to push a little bit more water through increased pressure into the cell to clean them up. But since we already have a low-grade inflammation because of the toxic nature of this tissue, even the mildly increased pressure is going to create more headache. And we are actually creating inflammation to help ourselves to hydrate and cleanse faster, but at the same time this process is causing headache. Now, can we do this slower? Yes, it takes a long time, but still eventually we are going to end up with the inflammation, because your cells are very dehydrated. And this is one of the ways that the body finds the solution to the problem. This is the same reason why some people do not have headache when their blood pressure comes up, But some people can have just slightly increased blood pressure and immediately go in headache. Why? Because they already have low-grade inflammation there. And it basically makes the head heavy. They just don't feel right, but no pain. But slight increase now of the blood pressure there through further constriction of the arteries, or by simply heart accelerating to try to clear out the area faster. Enough blood pressure is risen to create pressure sufficient to create headache. The withdrawal symptom from caffeine usually lasts 3 days. After the third day, the fourth day, too rapidly the headache goes down, because also the inflammation goes down. What had to be achieved through inflammation has been achieved, and now the rest of it is going to be going through the regular pathways of cellular hydration, either passive or later on active when blood becomes clean enough. Why do people suffer from migraine headaches? Because they are low on plasma chronically, and there is always low-grade inflammation going on in the meninges, and every slight increase in pressure is going to create headache, being it just accelerating heart rate or some further constriction of blood vessels. Very often it is the slightly accelerated heart rhythm that will create enough pressure to cause headache in already slightly inflamed mening of the brain. My recommendation is, if you decide to go on with the protocol, stop caffeine, stop it in one shot. And if necessary, and you really have a big headache and you cannot sleep, well, take aspirin, take ibuprofen, because it is going to pollute the blood and stop the inflammation process. Headache goes down. But it's a different type of a poison, gets cleared, and you continue with the detox. So there is always room for medicinal remedies if you know how to use them, and do not rely on them by continuing poisoning yourself and counteracting it with medicinal remedy, because the medicinal remedy is toxic, so it is going to increase overall toxicity of the body. Symptoms will change, but healing is not going to occur. You are going to get more and more toxic. Usually after the third day, the headaches go away. People who had suffered chronically from headaches, as the hydration continues, they will slowly start feeling relief from those headaches. First, they will be less frequent and less strong, and this is going to be dropping until they completely go away, because you basically cleanse the meninges, so there is no inflammation going on. And then even if heart rate increases, this is not sufficient to bring the level of pressure necessary to create pain. So it is not going to happen. Very often we have a headache when we have fever. Same reason. There is inflammation going on. And fever usually increases the heart rate, increases pressure. Once when you break sweat and you get toxins out, everything calms down and headache is gone. There is no mystery behind headaches. Doctors cannot solve the problem because, again, they have the wrong idea about what is inflammation. And if you don't understand it, you don't know what to do. So, the only reason why we have headache is increased pressure on sensory nerve. And it's usually done through inflammation. Now, why is the inflammation? Well, it is the toxicity, toxic blood, detoxifying symptoms, toxic cells, acidic, dehydrated cells, which are the reason why the inflammation sets in the first place. If you chronically suffer from headaches, you will notice that after well hydrating, soon in a process, the headaches are going to become less violent because the inflammation goes down and then disappear altogether. And same will happen with all pain in any part of the body, because the mechanism is the same and the causes are the same. It all starts from toxic blood. This is why cellular protocol is so effective. There is no mystery. There is only misconception. We are being drawn to a wrong path to understand things the way they are not. And then we are puzzled why our solutions do not work. Well, we are doing all the wrong things. We are doing all the wrong suggestions. Increased blood pressure does not cause the headache. It is the inflammatory process in combination now of increased pressure of local tissue because of the inflammation. Why is that happening? Well, we know toxic blood. Always toxic blood is behind everything, because from there goes into toxicity in the cells and inflammatory processes. Simple pathway. Faster we go through with it, the faster we feel improvement and we feel better. Of course, when we have a damages already done on a cellular level in our circulatory system and then muscular system, then it becomes more and more difficult with more and more symptoms occurring during this hydration and cleansing period. And one of the very common symptoms is water retention, which is not retaining water, it's retaining the toxic liquid that body separates because it cannot fast enough get rid of it. And then we think, by reducing the amount of plasma, we are going to reduce the water retention. Yes and no. Because by reducing the amount of plasma we take, we are reducing the speed of detox. So the toxic liquid remains longer in the tissue. But at the same time, more of this liquid we take, we may cause more of toxic liquids to be retained because body is in a bad shape, circulation is shot. So in that case, we need help of certain remedies. How we can help? Using diuretic to eliminate more water faster, including the toxic one. And the problem actually is much worse when people have respiratory problems, if their lungs are shut, because now they are creating a toxic mucus that they have to cough out, and at the same time, because of the huge amount of toxicity, body cannot eliminate it this way, and it settles in form of retention of toxic liquid in the lungs. In that case, it's best to siphon it out. Again, diuretics help, but taking diuretics and not taking plasma again does not allow your blood to cleanse, so it's a double-edged sword. So once when we are in this cleansing process, well, we have to see how is the best way to deal with this, especially in elderly people, because longer you are being poisoned, the more destructive things happen in your tissues. And again, blood circulation and mucosal tissue, the digestion and the respiratory tract, they get always the most affected. Why? Because through them you also eliminate toxic elements, like through kidneys. Why does kidney fail? Because there is lack of plasma. So the toxins remain in the kidneys longer time, causing dehydration. Later on, this same thing happens with the mucosal tissue. Why do the digestive problems? It's not only because you eat wrong, but also because your blood is extremely toxic. So these toxins are oozing out as a toxic mucus through your membrane of mucosal tissue. So all this we have to understand, and this is what we call disease. It's no such a thing as disease. Diseases do not exist. We gave names to symptoms. Why somebody has COVID-19 and somebody has Omicron? Because Omicron has milder symptoms. Bingo! There's nothing that can be tested on test kit because they are obsolete. They don't test anything except protein. It's your protein. Nothing to do with any virus. So what diseases you have is subjective. It's based on symptoms. And when somebody says, well, I'm asymptomatically sick, yeah, in the head, right here. Only idiots can be asymptomatically sick. You can be toxic, but disease is based on symptoms. So if you don't have any symptoms, then you don't have disease. It's too much for doctors to absorb. They are not meant to think. They are meant to write prescriptions. Okay, my friends, I hope that with these reminders, we are tuning ourselves into a correct direction, starting to understand how the body works, what is this thing called disease, what is causing pain, how we can prevent this pain to occur or minimize it and get rid of it. Simple. We have to detoxify. And now we are in an age of detox. because not only we have to detoxify what we have created directly, but we are detoxifying also our RNA. We are detoxifying genetic pool, leaving behind what we don't want to transfer into the new game we are creating. So many emotions, they have to be destroyed. They will flow up and let them go. You don't want to take them with you. Thank you for listening. Love you all.